very much indeed. Okay, I've been promising all programme for a big mega debate on health. And this is sparked to some degree by Therese Coffey, the Health Secretary, and her refusal to outwardly support the smoking reduction plan for England, saying she's not focused on it. Now, remember, the government promised to publish a tobacco control plan, quotes, later this year. But ministers are expected to break this commitment, according to Whitehall insiders. This comes amid a backlash from health campaigners over cabinet plans to scrap its entire anti-obesity strategy, after ministers ordered an official review of measures designed to deter people from eating junk food, like the cheap, buy one, get one free kind of thing that you see in some supermarkets. So is the government doing enough to promote a healthy lifestyle? Well, earlier, I spoke to Dr. Sarah Jarvis, GP and Clinical Director of Patient.info, and Jason Reid, UK lead at Young Voices UK and public health policy commentator. I began by asking Sarah what she thought about the U-turn.
I'm absolutely horrified. We've done a huge amount of work in recent years. In 1974, 45% of UK adults smoked. We've now reached the stage where we've got lower levels than we've ever had before. Worldwide, there's a huge move towards a smoke-free world where it's not socially acceptable to smoke, and we have really moved towards that, but where also we can reduce the number of people who die from smoking-related diseases. Half of people who smoke will die from a smoking-related disease if they keep smoking. And I've looked after, I haven't just been a GP for 32 years. I've been a GP in a really deprived inner city area of London for all that time, having come from a very affluent area in my previous life. And I've seen how difficult it is. I've seen how addictive smoking is. I've seen how, if we then go on and look at obesity, how difficult it is to keep your weight down. Time was, only a couple of centuries ago when obesity was a disease of the rich. Now it's a disease of the poor. The simple fact of the matter is that these things are incredibly addictive. Patients who smoke really need all the help they can get. And the idea that we're going to give this up for a short-term gain on the basis of a soundbite, I think is absolutely horrifying.
Jason Reid, you're a public health commentator, but you also rail against the, quote, nanny state. After listening to the power of what Sarah Jarvis has said, backed by years of experience, how could you possibly disagree?
Well, Sarah's absolutely right that the number of people who smoke is declining year on year. And I think that's a very good thing because we know that smoking is incredibly unhealthy. The problem I have is I don't think it's the job of government to be interfering and doing finger wagging and telling people your lifestyle choice is wrong. There are so many reasons why. I think that we are edging towards a really, really dangerous position on smoking, assuming that we continue with the policy direction, which it seems like Liz Truss is set on reversing. But at least in recent years, we've been moving towards a position where tobacco is treated in a similar way to drugs. And I think we risk replicating the mistakes of the war on drugs, where you haven't done anything to address demand, but the market is incredibly unsafe because it's not regulated, because people don't know where their products are coming from. There's no regulation of the supply chain. Of course, we don't know where the money is going.
Well, hang on a minute. Jason, there's huge regulation of tobacco in this country. What are you talking about?
Exactly. And so I want to keep it that way. My concern is that we're edging towards prohibition. Sarah was talking about making society smoke-free. Well, there is always going to be a contingent of people who want to smoke. And I think that they should be allowed to smoke and that they should be allowed to do so safely in a regulated environment. All these kinds of policies which people who talk about smoke-free England promote, things like higher tobacco taxes or plain packaging, things like that. They either don't work, as we've seen from evidence around the world, or they just are actively harmful because they inflate the illegal market and, in the case of taxes as well, worsen the cost of living crisis. We've seen smoking rates consistently drop because people are choosing not to smoke. That's a generational shift.
No.
Sarah, I need you to come back in there.
No.
So if we've managed to reduce the smoking rates by, 3/4 in 50 or so years, it's apparently because people have decided voluntarily they don't want to smoke anymore.
What a complete load of nonsense from a man who has not spent a minute, let alone 32 years, sitting in front of patients who are desperate to give up, who have tried so many times to quit. We know that the likelihood of you quitting successfully if you go cold turkey is about 1% per year. 99% of people who try to quit cold turkey will not manage it. More than 2/3 of people who smoke really want to quit. I have virtually no patient who's smoked for more than 5 years who doesn't want to quit, who wishes that they had never started. The simple fact of the matter is that tobacco manufacturers go to extraordinary lengths to make tobacco addictive, to get nicotine into your brain really, really quickly. And the simple fact of the matter is there is no comparison with illegal drugs. This is a drug which is freely available in the same way that we have real issues with food, because you can't tell people to stop eating, and therefore they need some food in order to eat. And that's why you can't just say to people, we can give you the help you need to stop completely. If we give people the help they need, then there is a really good chance they will quit. We've got increasing evidence, for instance, that vaping, which we know is not without risk, or we don't know it is without risk. So the chances are there are some people who will come to harm, but it is at least a new review that's come out just in the last week or so has shown that it's dramatically less dangerous than smoking traditional cigarettes. We know that if we can give people the support that they need, they are more likely to quit. The simple fact of the matter is that if you're living on the breadline and you've got all sorts of financial problems, which heaven knows people had before we got into the financial mess that this government has put us into. If you have an abusive spouse, if you've got financial insecurity, if you've got psychological problems, etc., actually, it's even tougher to quit a really addictive drug. These people deserve to be helped.
Right.
And the idea that not helping them is a nanny state is completely absurd.
But
and
Jason believes,
if Jason has got even 5 minutes of having to help these people on the ground, knowing what it's really like, rather than pontificating from a complete lack of experience, then good luck to him.
Now, Jason, you have to come back and robustly, because you spoke with passion earlier. I've seen your writings, and you believe that British people who want essentially to be free reject this deep down. At their core, they don't want to be nannied. They don't want to have the finger wagged. One of the reasons why Liz Truss is Prime Minister is because she promised the heartland of the Tory party that she would set them free. Over to you.
Well, listening to what you said there, Sarah, I think we agree on more than you think. Of course, quitting cold turkey is going to be incredibly difficult. I'm not suggesting anyone should do that. You talked about vaping. I agree with you completely. Vaping is healthier than smoking, and I wish that we would have more resources in terms of helping people to quit that way. The problem we've got is that so many people on the pro-nanny state side of the argument want to eliminate, in this kind of blanket way, things like vaping, not least the World Health Organization, even though it is the way out of smoking for so many people. But I'm glad that we agree on that at least. The problem I have is that this tobacco control plan, as it's called, these kinds of plans and documents from government, they're never just about helping people have access to resources and access to information. If it was just that, then I'm with you completely. Let's do more of that. The problem is they always come with these additional recommendations for more taxes and more regulations and more plain packaging. There was one earlier this year or last year about printing the words "smoking kills" in very small letters on the side of each individual cigarette, and ridiculous things like this that don't work and that just represent a finger-wagging nanny state that we do not need. And let's not forget also the people, I'm going to bring it up again, the people who don't want to quit smoking. I think you said the figure is about 2/3, which is similar to what I've read as well. So that leaves 1 in 3 smokers who have no interest in quitting. What business is it of yours or mine or the government's if they want to continue doing that? We know it's unhealthy. We've given them the information. We're giving them the resources they need if they decide to quit, and that's great. But there is going to come a point where this smoke-free dream has to die, because there are lots of people who like smoking and they want to keep doing it, and it's their body, and I think they should be allowed to do that.
There you go, Sarah. It's bodily autonomy. People can name their own poison, and so long as they're not harming anybody else, what business is it of yours, GP or no GP?
Well, the simple fact of the matter is that when you drill down to these patients who supposedly don't want to smoke, and I speak to them on a daily basis, as it's quite clear, Jason, you don't, they will say, I don't want to quit. But actually, when you talk to them, it's because although it's costing them a fortune, and although it may be that they are aware that it's going to shorten their lives, that is because their lives are so difficult at the moment that it's not their priority. The vast majority, even of those 1/3 of people who do not want to quit smoking, would love it to be easier for them to quit. They actually would really like it to be easier for them not to be constantly tempted. So when we have that figure of 1 in 3 people not wanting to quit, actually, if you talk to them on a day-to-day basis, these are people who really, if their lives were different, they probably would want to quit, but it's not at the top of their list of priorities. The simple fact of the matter is that it's costing them money, that they may get short-term gains, but actually, they haven't yet recognized that addiction. I mean, a lot of people who take heroin, a lot of people who take all sorts of recreational drugs, even those who take crystal meth, will say, oh, well, I don't want to quit. Actually, really they do, but it's because they have not yet come to terms with the fact that they have to go through the process of quitting. And quitting smoking is not easy. It's an incredibly expensive habit. It kills an awful lot of people. It costs the NHS a vast amount of money. And please, please don't insult our listeners by talking about the amount of taxes that these people pay and the fact that they are more than paying for the amount that they're going to cost on the NHS to kill themselves, because the figures just don't add up.
Jason, how encouraged are you by not only Therese Coffey's plans to apparently quietly ditch these targets, but also the overall position of this new government led by Liz Truss to stop nannying people on buy one, get one free, on obesity and other areas of food and health? Do you think it's welcome, even if it costs people individually? Or do you think it doesn't matter because in the end, people have to be free?
I'm cautiously optimistic about this new government. Let's not forget that Boris Johnson said the same thing and then ended up doing the opposite. He called himself a libertarian before he was in office and then ended up expanding the nanny state.
Well, that's partly because of his little dance. That's partly because of his little dance with COVID, which became a very serious dance.
That's absolutely right. And then he went on to lose lots of weight, which is great for him. But then he suddenly decided that everybody else needed to lose weight and that they needed his help to do it and the government's help to do it, which he hadn't needed in order to cut out the late night cheese, as he put it. But on the issue of vaping and tobacco, I didn't make that point, by the way, Sarah, about people not paying for their own NHS care, and I wouldn't make that point, so don't put words in my mouth if you don't mind. But when it comes to vaping, I think that this is a big part of the way out. Let's just give people the education and the resources that they need and then leave them alone. Let's not increase the nanny state. Let's not interfere in people's lives. It's worth saying that the reason this is in the news today is because of a very innocuous comment by the Health Secretary, Therese Coffey, in which she was asked about this. And she said, well, I don't really know anything about that. And she sort of wouldn't commit to it one way or the other. But she said that her focus is on what she calls the ABCD, which is ambulances, backlog, care, and doctors and dentists.
To be fair, Jason,
exactly.
To be fair, Jason, the reason why she was asked the question was because of reports in the papers, in The Guardian and The Telegraph today. That's why the reporter or the presenter asked her the question.
Well, either way, I don't think it's the kind of thing the government needs to be focusing on. She has plenty to do with sorting out the NHS, sorting out ambulance waiting times and the backlog and so on. She does not need to be finger-wagging people and telling them your lifestyle is wrong and I'm going to make your life a little bit more difficult. When you look at the polling numbers, especially when it comes to vaping, and you ask smokers about vaping and whether they would consider switching from smoking to vaping, there's such a large number of them who aren't even aware that vaping is healthier than smoking, and that would be a sensible thing to do. There are so many people like that because of the misinformation, because of the scaremongering from the World Health Organization, from Public Health England, as it used to be called, and from various other affiliated bodies as well. I think we need less of that We need less of these top-down organizations getting involved and more just giving people the resources that they need when they want to quit. And other than that, leaving them alone to live their lives as they see fit.
Is that how you see it? Is that what you think? We need less government in healthcare and everywhere else. That's Jason Reed, UK lead at Young Voices UK, and Dr. Sarah Jarvis, a GP and clinical director at patient.info. Your thoughts on that? I thought it was a really great discussion. You can get in touch